Metoprolol beta blocker uses and contraindications. Metoprolol is a selective beta-1 adrenergic receptor antagonist used for hypertension, arrhythmias, and heart failure. It is contraindicated in certain conditions due to potential adverse effects. Overview. Metoprolol is a long-acting, non-selective beta-1 adrenergic receptor antagonist used primarily in the management of hypertension, arrhythmias, and heart failure. It is available in various formulations, including immediate release and extended release, with dosages ranging from 25 mg to 100 mg per day. Its mechanism of action involves blocking the effects of catecholamines on the heart and blood vessels, leading to reduced cardiac output and lower blood pressure. Pathophysiology/mechanism of action. Metoprolol selectively binds to beta-1 receptors in the heart and beta-2 receptors in the airways and blood vessels. By inhibiting the action of adrenaline and other catecholamines, it reduces heart rate, contractility, and myocardial oxygen demand. This makes it effective in treating conditions where excessive cardiac workload is a concern, such as hypertension, arrhythmias, and heart failure. Clinical features/indications. Metoprolol is indicated for the following conditions. 1. Hypertension. It is commonly used as an initial therapy for essential hypertension, particularly in patients with comorbidities such as diabetes or renal disease. 2. Arrhythmias. It is used in the treatment of supraventricular tachycardia and other arrhythmias, often in combination with other medications. 3. Heart failure. Metoprolol is effective in the management of heart failure with reduced ejection fraction, HFrEF, often as part of a multidose regimen. 4. Pain relief. It is occasionally used for the management of chronic low back pain, though this is less common and typically not the first-line treatment. Diagnosis/monitoring. The diagnosis of metoprolol use involves assessing the patient's medical history, current medications, and potential contraindications. Monitoring is essential to ensure safety and efficacy. Key monitoring parameters include key points, blood pressure, target 140/90 mmHg. Electrocardiogram (ECG) for arrhythmias. Regular assessment of heart rate and rhythm. Serum potassium and magnesium levels, as metoprolol can cause hypokalemia. Treatment/management. Treatment with metoprolol should be individualized based on the patient's condition and comorbidities. Key considerations include key points, starting with the lowest effective dose. Monitoring for side effects such as bradycardia, hypotension, and hypoglycemia. Adjusting the dose based on blood pressure response and patient tolerance. Combining with other medications when indicated, such as ACE inhibitors or diuretics. Key clinical points. Key points. Metoprolol is a long-acting beta-1 blocker with a favorable safety profile in many patient populations. It is contraindicated in patients with severe bradycardia, hypotension, or significant hypokalemia. Close monitoring is necessary to prevent adverse effects, especially in elderly patients or those with comorbidities. It is important to assess the patient's overall cardiovascular status before initiating therapy and to adjust the treatment plan as needed. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.